Hello, my name is Danielle Demeza, and this is my week 2 discussion, Is Healthcare a Right? So when we talk about healthcare being a right, it brings up the topic of what other countries have for their citizens, which is universal healthcare for all. Many countries believe humans should have access to basic healthcare needs and preventive care measures, as well as low-cost medications and treatment. The US is known for our high healthcare costs and alarming number of uninsured citizens. While Medicaid has made a huge difference for low-income individuals, pregnant women, children, and the elderly, that is still 200 million Americans who have to find their own means of coverage. In 2021, of those 200 million, roughly 30 million were reportedly uninsured. And this number does not include the amount who are insured but still face financial deficits with their medical costs. Universal healthcare has the goal of bringing affordable care to everyone, regardless of status, income, or pre-existing condition. So I chose the pro. The United States already has universal health care for some. The government should expand the system to protect everyone. And my con is universal health care would raise costs for the federal government and in turn taxpayers. So while I truly understand the limitations the elderly have to resources, as well as low-income individuals, pregnant women, children, I do believe that everyone deserves to have access to Medicaid-type coverage. All Americans have to pay taxes, but only the certain groups receive the benefit of low-cost or free health care. Federal program Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, the elderly, and people with disabilities. This accounts for about a third of the U.S. population. While this is a great program, many Americans feel as though they are paying for these services through federal taxes, they should have access to the benefits. Every citizen is deserving of living a healthy life, and some may just be out of the income threshold to qualify. That does not mean they can afford any and all medical services. Additionally, those who do not qualify for their entire lives, they may only get health care during this coverage period. That means weeks, months, or years of not affording quality health care. Additionally, not all jobs provide these benefits either. Universal health care would give all citizens the ability to get proper health screenings, preventive care, and quality treatment or management if necessary. So for my con, Americans already complain about having to pay taxes in general. However, every state does have different taxes. Universal health care would still affect them all on some level. As the article discussed, imposing universal health care coverage would not be attainable by just taxing the wealthy more heavily. There would have to be higher taxes for all, if not a completely new system of taxing to cover all costs. Whether those taxes are directly imposed on workers or indirectly imposed through employers, it is believed that roughly 70% of working privately insured households would pay more under a fully funded single-payer plan than they do for health insurance today. So how could this pro and con impact potential health outcomes in Massachusetts specifically? So the state of Massachusetts is known for the high level of healthcare offered. People from all over the U.S. travel to Massachusetts to receive their care here from one of the various high-ranking facilities. With universal health care, Massachusetts residents could actually take advantage of what these hospitals and clinics have to offer. There are definitely some of the wealthiest people in Massachusetts, but that does not mean there are not towns and cities with citizens making well below the average income. These people would benefit tremendously and may even have the ability to pay for the transportation it would cost to get to the facilities when they don't have to pay for the medical bill out of pocket. However, Massachusetts is well known to be a state with higher taxes than others. In 2022, it technically ranked number 37 amongst the 50 U.S. states when it came to state and local tax burden combined. However, Massachusetts residents typically make more money, therefore their income raises them into higher tax brackets. In 2023, Massachusetts residents can expect to pay the highest average income tax across the nation at 24% per paycheck. Massachusetts also has the lowest uninsured percentage of residents at 3%. Knowing with universal health care, they'll have to pay even more taxes, especially when the majority of Massachusetts residents make good money and can afford their own health care costs. They may be very reluctant to pay for universal health care. So I do agree with the current role that state government plays in provisions of healthcare. I believe each state has different needs and can even be specific to the location. If we only had federal policies, that would be broad and potentially not applicable to some states. It would take decades just to touch on each specific concern across all 50 states. With state government able to control aspects such as health monitoring, sanitation, and disease control, as well as the financing and delivery of personal health services, it allows them to care for the communities in a more direct role. State legislators are also a bit more accessible to the public as they are typically long-term residents and hold meetings for locals to attend. They know what their communities need more than someone on a federal level would ever understand. Additionally, there are many aspects of healthcare policies that relate to certain politics. Massachusetts is considered one of the most liberal states in the US, and almost always, every elected official is Democratic. If the majority of the state feels similar to those who they voted for, then they will typically agree with the policy decision as well. I also believe the state should play the main role in the development of health policies. They know their residents better than the federal level of policymakers. However, some changes can be stunted by finances on a state level. Most states are required to have a balanced budget. If the budget is not balanced, states will raise revenue or cut programs, but money can be shifted and allocated to other programs to help balance the budget. States try to prevent cutting programs and shifting money due to decreased funding and negative public turmoil, but oftentimes it's unavoidable. So, all in all, I do think the states definitely should be involved. And universal health care is definitely a topic that should be discussed in the US, but I'm not sure it's something that will ever happen very soon. Please let me know if you have any questions. And thank you for listening to my presentation.